Welcome to AWAMS, and thank you for stopping by to see about our product. Hopefully I can explain a little about where we've been and where we think we're going. AWAMS is a software program that allows non-invasive, non-contact surface area measurements. Now, this product was originally started in 1995. The way it started was that I was working as a physical therapist, and I still am actually, a physical therapist who was working in home health at the time with wound care nurses. Now, prior to that, I was an electrical engineer. I had my bachelor's degree and master's degree in electrical engineering, and so I had a lot of programming knowledge. What I saw at the time was that they were using a Polaroid camera to take pictures of wounds that had to be a certain distance from the wound, or they would use a plastic overlay. Neither of these methods really proved out to be very accurate. With changing technology, I thought that perhaps we could come up with something better. So what we started with was a digital camera, and at that time very few people had digital cameras, so I had a hard time getting people to use it. At the time, what we did was we measured cross-sectional measurements, where we would take one measurement across each of the widest parts of the wound and then generate an approximated elliptical function to get the area. That was reasonably accurate. Since that time, technology has come a long ways. What we do now is we actually trace the wound around the wound, and if there are more than one tissue types, we can measure up to 8 different measurements on one photo. Each of those gives a very accurate area measurement. Now, the beauty of this system is that it's non-contact, and it's also non-invasive, and there's no problems or no concerns about infection control. Most facilities now, that's a critical item because we have a lot of very virulent germs running around out there. So the non-contact has become very important over the years. Now, the next thing that has become important is actually having something that's accurate. Current Medicare requirements require, in order to use certain CPT codes, they require an accurate measurement. What I found from testing, and we've done some testing with nurses, is that the overlays are not accurate. The Polaroid camera was nice, but it actually gives you no better of a measurement than an overlay because you have to estimate the area just by looking at it. This is the first time that we've seen where you can actually trace out a wound and get a completely accurate, within probably 2%, accurate measurement of the area of the wound. That's very difficult to argue with in an audit because it is accurate. Finally, it allows the development of a wound care protocol that is uniform from one nurse to the next and from one week to the next. So because it has built-in descriptors of the wound, when one person goes out and measures a wound and creates a report one week and another person does it the next week, the error of the measurement is not subject to that particular person, nor is the error or the reporting method. It's very uniform. Now, in an audit, that also becomes critical, and you know that if you've ever been audited in your facility, especially in nursing homes where when they audit, they're actually very in-depth. Now, for a nursing home, the last thing that we came to learn as we developed this is that many nursing homes do not want to store files. So we developed a very new technique of creating an on-screen picture that is not stored anywhere. It just goes to the screen, and we can freeze it on the frame. We can take the measurement on the frame. We can then store the report, and when you bring it back or print it, there's no photo on the machine. What there is, though, is a complete graph of that wound. So the next week, when you go measure it again, you have another complete graph, and you can do a comparison, and it will tell you what the percentage reduction of the wound size is for each area. It'll tell you what the square centimeter reduction in size is, and it's a very accurate reporting method. Now, as we go into the future, having an electronic record is going to become critical because though many of us still have paper charts and we do everything on paper, that is actually going by the wayside. So we feel that we are absolutely the most advanced product out there in this area. I'm pretty excited about bringing it to you. We've been working on it since 1995, and it's been used in nursing homes, as you can see, and home health facilities. You'll see that on our